Today let's look at some trachs, tracheostomy tubes. We have a problem with this person's airway, and an endotracheal tube down through the mouth won't work any longer. Perhaps it's been in too long and has eroded away the mucosa of the upper airway. So we have to put a trach in. The trach is put through an incision through the throat into the tracheal airway. So here we've made an incision into the trachea through the cartilages, and this is his airway. We need to put something in there that will help that stay open and ventilate. So we're going to use a trach tube. Here we have a trach tube, and this one is a size 6. It comes with an inner cannula, the inner cannula, the outer cannula, the cuff on the end, and here we have a different size. This is a size 8, and it has the outer cannula and the cuff, and of course the pilot balloon. This is a twist off inner cannula with a lock in it. So if you turn it this way, it locks. Turn it the other way, it unlocks, and then it pulls out. This is the inner cannula, and we can take that out a couple times a day and clean it, get all that phlegm off of it. Now, as you can see, as we inflate this cuff, we pump air into it and it gets inflated, which squeezes up against the trachea and seals off any leak so that no air leaks around it. Here I have a little device called an AG cuff fill, and as you can see, this will give a numerical reading of how much pressure is in that cuff, and we want to regulate that cuff pressure from a high of 35, right about there, down to a low of 25. Of course, the lower the pressure in the cuff, the lower pressure exerted onto the tracheal wall. And as you put more pressure onto the tracheal wall, you cut off the blood flow of that wall, and that causes tracheal damage. So you want to keep your pressure of your cuff to the minimum. This is one way we check it. Here we have a size 8 cuff trach, and the inner cannula, and the obturator. The obturator has a nice smooth end on it and just slides in. It does not lock because it's not supposed to stay in, but it presents this nice smooth ending here, so that when you insert this into the trachea, it does not cut up the tissue around it, as would just this sharp edge. So you use the obturator to insert it. Once it's in, the obturator comes out. After the obturator comes out, the inner cannula then is placed in, locked in place by twisting, and then you can connect a bag or a ventilator and ambu the patient. A size 8 fen, F-E-N, it's fenestrated. Fenestrated means there is a hole in it, a window, fenestration. And what this does, this allows the patient to breathe through the tube and up into the upper airway through the vocal cords, so that they are able to speak with the tracheostomy in without using a speaking valve. So this replaces a speaking valve, or takes the place of a speaking valve. There is an inner cannula. The inner cannula is fenestrated also. There's a hole in there. It makes sense. If you put this in here, then they line up and the air goes all the way through. If you take a fenestrated cuff and put a non-fenestrated inner cannula in it, this is no longer a functional fenestrated cuff. So now air is coming out and in through the tracheostomy tube and not up into the upper airway. So By changing this inner cannula, we can now positive pressure ventilate this patient and still have a fenestrated cuff in. Now here we have a metal tracheostomy tube. It is uncuffed, and this is the obturator that inserts just like this, and the tracheostomy tube is just placed into the trachea. This comes out, and the inner cannula is metal, and it slides in and locks in place. This stays in the trachea, this comes out, and then this is cleaned and placed back in again. First, we take out the inner cannula, drop that right in front of him. This is a long-term permanent trach that doesn't require positive ventilation. So there is no attachment point for a ventilator or a ambu. Obturator goes in and is held in place by your thumb, and this thing goes right in the tracheostomy hole, just like this. After this is placed, pull out the obturator and insert the inner cannula. That locks in place with a little twisting motion again, and you're all set to go.